Hello, good evening, good day, good morning, or good afternoon, wherever you are in the world. Welcome to the Black Belt Academy of Surgical Skills. If this is your first time joining the Black Belt Academy, welcome. And if you are returning, thank you very much indeed. I really do appreciate the fact that 11,000 people watched last week's lesson with 10,500 engagements, 300 likes, and 15 shares. Much appreciated. My name is David O'Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom, and I'm also the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. Tonight we're talking about assisting, and I've titled it Equal and Opposite for good reason, and I'll explain why as we go through. Assisting is often thought of a passive activity. On the contrary, assisting is very much an active activity and is essential for good operating and smooth operating. In order for you to understand the operation and the flow and the steps, I usually recommend, whether it's a scrub nurse or surgical nurse practitioner or a trainee or student, that they watch the operation from the top of the table and they understand its various steps. In order for you to get the best out of assisting, I think it's important that you do a little homework beforehand. Obviously, know the patient, because that's what we're there for, but also understand some of the anatomy and look up some questions such that you can interact and ask the surgeon at appropriate stages during the operation. And my favorite annual when I was growing up was this: look and learn. And I think it's a prerequisite to assisting is to learn about the procedure and to have a look. This is my annual for 1975 when I was 14, and I have the pleasure this evening of introducing my surgical assistant is my son Alistair. And Alistair is 14. Now, for those of you who've been watching the Black Belt Academy, you might realize that when we started out, he was at a slightly different height. And only 2 weeks ago, he was 4 millimeters shorter than me. And now looking at him across here, I think you'll agree, he is taller than me. And this is the first part of the equal, is that it is important that the assistant and the surgeon are at the same heights, equal heights, because you both have to optimize the function of the upper limb as previously described, and we'll go into more detail next week. I had a trainee who was 6'4", and Michael said that I was the only consultant to ever stand on a stool to assist him when operating, or to stand on a stool when I was operating so the table was an appropriate height for him to maintain the functional anatomy of his upper limb and the posture. Now, the other thing about assisting, it is an active process. And we have actually interviewed people in dancing with dance partners. And to be a good dancer and follower, you need to understand the moves and move in harmony and synchrony with the lead. And that is much the same way we should be operating, is that we're moving in harmony and moving in synchrony. And there's simple rules of thumb, I believe, to describe that. So firstly, we got to keep our shoulders parallel at all stages during the operation, because we don't want to be reaching across the midline. We don't want to be crossing our hands as well. And keeping our shoulders parallel means at all times our hands are not interfering with each other. So as we move round, if I move to my right, and there's a movement there. If I move to my left, and the movement is there. And at all times, we are opposite. And the midline between us stays midline because as an assistant, really don't want you reaching across the table into the operative field. And I really don't want you crossing your hands either, because that's going to impair the way you use your hands. Now, it's also important, as with these exercises, that your right hand and your left hand, as with operating, have to work interdependently. And you understand the various cues and clues that are given by the surgeon as we're operating. So the movement around the table can be as subtle as simply changing the weight on one leg. So if I change the weight on my right leg, and predominantly Alistair changes the weight on his leg, and you see the tilt of the pelvis and tilt of the shoulders, we are still equal and opposite. And the other way, equal and opposite again. This will always keep functional working of your hands separately. Okay, so I'm going to move over to the head cam as we introduce some other principles and some new models to help you practice at home. And I'll move it over. Just hold on tight. Sit it in the box. So let's, on this model of the plate, say that the operative field for me, and take a forceps out, the operative field for me is within the central area here. And Alistair needs to keep his hands on the outside. And usually this is delineated by the retractor. Now, this important principle I remembered when working with Mr. Stephen Westerby, who did some of the best films for aortic roots. I nicknamed him Steven Spielberg Westerby because of the quality of the films. But what he was adamant about is that as the assistant, your hands did not come in the central field. Actually, it's because your hands were covering up the filming and the quality of the picture. But I think it's pertinent that your hands are not obscuring the view. All right? So no matter if I walk around to my right, my hands, if that's the midline, my hands are still in the middle. And Alistair, do you want to keep your hands on the outside? And Alistair's hands on the outside. And if I walk around this way, you see the hands are still on the outside. So we've defined the midline, we've defined the operating area. Most of the time when you're assisting, keep your forceps in your hand, Alistair. Most of the time when we're assisting, we're having to hold a suture. Now, the important thing about holding the suture, it's a lateral hold and not a pull. I'm quoting Mr. Jim Monroe, use it with your fingers and thumb out. And it's a lateral hold and not a pull. And the important thing is that you take up the tension in the direction the surgeon is holding the suture. So usually when taking a stitch, the surgeon will hold the suture out in a direction and under tension, and you need to hold it in that direction such that your fingers and thumb are pointing towards where the suture came from. Because if you wrap your fingers around, and we'll demonstrate on the model coming up, it tears. So just in case you forget to let go, your finger and thumb, it lets go. So and where you need to hold it is effectively 2/5, 3/5. Okay, and the important reason for that is that the operating surgeon, let's say the end of this bootlace is my needle. Hold that, please, Alistair. And I am doing some suturing, and I'm going to take a stitch here. Let go, please, and I'm hold it up. Pick it up again, and you see it's held out in the direction it's taking. All right, and again, and it's held up again. Move your body around in the direction, and it's held up again here. So as you will realize, as I'm going round in anastomosis, at this point, usually between 4 o'clock and 5 o'clock, I'm changing direction and going backhand, all right? And in going backhand now, I'm standing on my left foot. If I'm right-handed, take a stitch, let go, hold it up, all right? I'm going to take a stitch, let go, hold it up, and each time that suture is held out on the vector, and it's a lateral hold and not a pull. Now, of course, as we go round, if I've gone from forehand there, and still hold that with your left hand, okay, you will need to actually bring your hands in a bit closer, you will need to swap your forceps. So if I've gone round and you suddenly realize that I'm going backhand, at that point, you need to swap your forceps over because now there's a different function, all right? As you continue, because at no stage do I want you to cross your hands, all right? And that is important. So I'm going to just demonstrate why holding the suture properly is critical in the direction. And you've been following the Black Belt Academy, you'll see our banana model, and I've just got a couple of things in there, which I'll come to in a moment. So if I take the suture through, right, and I pull it out, and this is a proline, and the proline with soft tissue can act like a cheese wire. Now, Alistair was just about to grab that with a forceps, and to remind you, do not hold plastic sutures, proline, with forceps. So it's finger and thumb again, and hold it out to the side. Okay, so hold it out to the side. I'm going to put another suture in and just demonstrate to you the problem if your finger and thumb is not off to the side. So finger and thumb, and if I don't prompt you to let go, let go. All right, so I'm not going to prompt Alistair to let go, hold that up. And I'm going to do that again. This time I'll hold the suture as if without your finger and thumb pointing to the side. And I'm not going to say let go, hold that, hold it tight. See that? And it tears the tissue. Is it torn there? Okay, it'll tear that banana. Now, as I'm coming round, I'm going to be using the forceps to hold the tissue as I'm going round. And part of the exercise and of assistant is to provide equal and opposite retraction. So in this model, in extending the stitching model, I've placed some staples in the banana. So if I'm holding here, Alistair needs to hold equal and opposite there. So hold that side, okay? And to follow as well. Follow finger and thumb on that side. So Alistair's never been trained in surgery before, but I think, remember, 2/5, 3/5. He's never done surgery before, but I think he's doing extremely well. But this is also just pointing out how we can actually point out the principles of assisting. So I'm going to hurry around this bit, and we've moved round, okay? And Alistair, I'm holding here, so you need to now hold equal and opposite there. And you'll find that with the staples in the banana, you either push them in or pull them out if you drift and drag, as previously discussed in our previous episodes. So this is between 4 and 5, and I'm about to go around the corner, and I'm going to change direction. All right. And forceps needs to swap over and follow on the other side. Now, if you don't understand this principle, you'll find that it really interrupts the flow of the operation. Okay, and I know a good assistant makes a good surgeon, and vice versa, because they understand the steps and understand the various cues. So if it is grabbed inappropriately, this will pull out. You see that? Just cheese wires out a soft banana very easily. The tension you hold is the gently lateral hold, but if you pull, you see again the suture pulls out. So it's not a question of pulling or tugging at all. There's a finesse and fine movement to this. As we continue this exercise, I was then reflecting a simple exercise to practice is to put a whole lot of staples in a banana, and if I'm holding here equal and opposite, Alistair needs to pick up the staple the other side. As we go round, and I'm going round, and try not to pull them out, push them in, and I think you're doing very well. And that's when I'd have to turn round. I swap my forceps over, Alistair swaps his forceps over, and we continue our equal and opposite retraction. And it's a deliberate pickup. So if you really want to now make that rather complicated, because that is just on a plate, we will put this in an operative situation. And I'd like to thank my colleagues at Wet Lab who support me on national courses, the Power Excellent courses, and provide these very nice training stations. I'm going to put the banana in there because now we're going to do the same exercise and it's a hold opposite, but we're at depth. Okay, now there's a little trick here. I have extended my pinky at the side to provide as a scaffold. So if you're a little worried about a tremor or movement, you can put your pinky out like that. Okay, so just follow me around. Now I'm going to be coming all the way around. Okay, and very good. Alistair hasn't actually pulled it out. You see how easily the staples pull out? I'm going now backhand, and I'm providing retraction again. Excellent. And you can see how easily those staples actually pull out. Yep, and again, and again. Now, assisting is, I believe, also a quality control assurance. And I'm going to use some cardiac terms now because I'm looking at this. Imagine you're lying flat on the table and your arms are outstretched. Your head is up that end. Your right arm is out this direction and your left arm is out this direction. And you see the two, past my forceps, you see the two are at 90 degrees. Okay? Now, if you think about it, every x-ray we do is taken at 90 degrees, such that you can appreciate the three-dimensional aspect. But I think this is equally important in assisting, because I'm looking at it from this side, what is called in cardiac terms right anterior oblique. And Alistair is looking at it this side, left anterior oblique. They're two different perspectives of the same thing. And to get the depth and the perception, particularly on difficult vessels or awkward places, you need to trust and empower your assistant to tell you if your stitch is accurate in those positions. And this is quality insurance. And this message is particularly for trainers. Your trainee is equal. There's equal status, equal rights, equal everything. They might not have the same knowledge or the skills, but they're equal and they're opposite you. And you can't do your operation as a surgeon without your assistant. And I salute the Royal College of Surgeons of Edinburgh in their Let's Hammer It Out and Let's Remove It campaign, because your assistant and the ability to is crucial to the success of an operation. So please, message to trainers, respect. But likewise, as a trainee, an assistant, learn to follow and learn the simple cues of assisting as we have described. Now, there's one last thing to add. I'll just remove the model again from the box, and that is the scissors. We've discussed the scissors previously, and the problem is with the scissors, and we've discussed use of scissors, I do not want to see an assistant come in from outside the light, swoop in and swoop out with the scissors. Assisting requires taking your scissors in, position it, opening it up no further than necessary to do the job, and cutting at the exact length. So I'm going to ask Alistair to do that, and I'm going to hold this piece of string and ask him to cut a centimeter of the end. And come in, Alistair. All right, position, open up, scissors, perfect, only a centimeter, excellent. That's not bad for somebody who's never done surgery, but should you have a tremor, hold the forceps. You're very welcome to hold your forceps and use your forceps like a fob to bring them in to cut. Simple thing when you are cutting, as I mentioned before, train yourself to cut at exact lengths, and you yourself will learn distances, etc. I find this particularly useful in vascular surgery and arteriotomies because I can tailor the various conduits to the exact lengths without nibbling them and trimming them regularly. So you can practice at home on your banana model and prevent that drift and drag and prevent sutures being pulled out inadvertently and prevent the staples being pulled out. And you can pair up with somebody and practice going round and swapping your forceps over and not trip over each other. I think Alistair did a fantastic job there. Very good job, actually, considering that he hasn't been trained in surgery. But what we have imparted is some basic principles, and in a very short period of time, past 22 minutes, he's picked it up. You can imagine repeating this on a regular basis, walking into theatre, the surgeon operating is going to have a beaming smile because they know they can rely and trust on the person to keep them in check, to make sure the stitches are good, and that their hands and their movement is going to be equal and opposite and complementary. In the same way, when dancing, your dance partner moves with you in one movement without interrupting the flow. And that is the pleasure of being a good assistant. I recall one operation where we did a Ross procedure and the surgeon kept on putting his forceps down and then tutting because he didn't know where the forceps was. And I picked the forceps up and I passed it back to his hand and he'd put them down again and tut and I passed the forceps back. I think the forceps went round the table probably 150 times during that period. Thank you very much indeed for joining us this evening. Thank you very much indeed for your time, and we'll see you next week as we will discuss the very foundations of the Black Belt Academy of Surgical Skills. That is posture. I wish you good night, be well, and be safe. I think we've had a problem with the video, but we've reached the end of the lesson, and thank you very much indeed.